Hi, this is Dr. Kathryn Dao. I'm reporting for Room Now for EULAR 2021. And I have a very special guest here today. It's Dr. Kristen Young. She's a recent graduate of UT Southwestern, my alma mater, from the Rheumatology Fellowship Program. And she actually is the first author and presented her study here at EULAR. Welcome, Kristen.
Hi there. Thank you for having me.
Absolutely. Thank you for being here. So you were actually studying about how the pandemic had impacted rheumatology training. Could you tell me a little bit about how this study came about and what you found?
Yeah, so I myself am ending my rheumatology fellowship this year. And at the start of the pandemic, lots of changes were made to my training program and many of the other trainees that are involved with the Global Rheumatology Alliance. So me and several other trainees involved with the GRA, work together to develop this survey along with program directors to administer across the world to see how rheumatology trainees were doing during the pandemic.
Right. And I know that you all have been affected a lot because at the beginning of the pandemic, everything was shut down. You couldn't even attend clinics and we had to switch so quickly to telehealth. So what do you think, just from your experience and also from talking to other people and from the survey, what were the main issues that you uncovered?
Yeah, we also have an abstract that at EULAR that specifically addresses telehealth and rheumatology trainees. And yes, there was a rapid adoption. We went from about 13% of trainees doing telehealth before the pandemic to over 80% during the pandemic. And that's a rapid adoption of telemedicine. That abstract addresses telemedicine specifically. But other areas that we found generally within the rheumatology training participants in the survey is there was a lot of other domains that trainees identified as being negatively affected by the pandemic. This included things like clinics and consults and ultrasonography training, didactic training, along with other clinic procedures. And I think that pivot to telehealth along with all these other training domains kind of go hand in hand. And then lastly, there was a increase in rheumatology trainees that did identify about 68% reported increases in work-related stress, and then also about 50% indicating that they were burnt out.
Right. And then I also found that you had written that 25% didn't even feel that their skills were up to par. How do you think that these trainees are going to make up for that?
I think, and that, that is concerning to have trainees feel like their skills aren't up to par or that they feel like their growth as a rheumatology trainee has been stunted by this. My hope as a trainee is that the time, period afterwards, we have ample amount of time to see these consults, to do procedures, to catch up. And I think my hope is that we catch up in that time period. But I do think this does ask the question of, do we need to resurvey people or do we need to implement any sort of kind of remediation? I don't like to use the word remediation, but any sort of, online training or something to get trainees up to speed or even see how they're doing a year into it.
Right. And one of the beauties during this pandemic, because we are such a virtual world, even this Congress is virtual. So being able to access educational material has been incredible. From the ACR Convergence to the EULAR Virtual Congress. And I know that the trainees also have access to other electronic didactic materials. Did you use that?
Yes, that's one of the things that I benefited greatly from during my training is all of the ACR and then even international events that were hosted online and virtually. So I was able to participate in the ACR, like they had a viral lecture, a VIP lecture. Those sorts of things were incredibly helpful for my training. And then I'm interested in autoinflammatory disorders. So being able to participate in the international autoinflammatory conferences was, I think, new and then also a great opportunity for me personally. And I think a lot of trainees are now learning to access those online materials.
Yeah, and I think that burnout and stress also occur even without the pandemic, to tell you the truth. What do you think program directors should do with the information that you put out there? I mean, how can they help?
Yeah, I think I'm not a program director, I'm just a trainee, but I'm certainly interested in medical education. So I think this data can help with reflection to see, check in on your trainees, see how they're doing, and see how they're doing a year into this. I know many programs have gone back to almost normal or pre-pandemic didactics and procedures, but then also knowing that trainees are experiencing stress and burnout. It is at a higher level. In a previous ACR abstract, they did look at some burnout, and the burnout was very low at that time in rheumatology trainees. We're usually a typically happy group, and I think the good news is that most trainees were very happy with their choice with rheumatology. So it seems like this is perhaps a temporary a temporary change, and program directors, whatever they can do to support, if that includes, and that should definitely be something that is like program dependent and really reflecting on these results.
Yes, and I hope also leadership in like the major rheumatology communities hear what you have to say, because I believe that rheumatology training is essential. I mean, you do training even after you graduate. That the time there, it is a time for you to be able to see new things, ask your questions. I mean, to be honest with you, I'm still in my rheumatology training even 20 years from now, working with Jack. Anyways, but thank you so much for your time, Kristen. And I really appreciate your effort and your work during this pandemic with the GRA. And I know that you're very active on social media, so follow her on Twitter. Follow me on Twitter, KDao at 2011. Your Twitter handle, Kristen, is at Kristen Young. Is that correct? Yeah. So I hope you have a great day. This is Dr. Kathryn Dao reporting for Rheum Now.